For more on COVID-19 in the U.S., I'm joined now by Dr. Gary Richwald in Los Angeles. He's an infectious disease expert and the medical director for Curative Medical Association. So, Dr. Richwald, first I'd like to get your reaction to news of this COVID pill by Merck. Is this a potential game changer when it comes to treatment?
Well, I think when it comes to treatment, it's a game changer. When it comes to new infections, that's yet to be seen. And I think the emphasis that was made that the number one problem we have in the United States is it's not about having an antiviral, which we haven't, and I'm glad Merck's done it. It's a sobering reminder that if you look at all Americans, including children and adolescents, less than 70% of people are fully vaccinated. We just are far short of the goalpost when it comes to controlling this virus. And when you add in the fact that we have influenza and respiratory syncytial virus right around the corner in late October, November, December, we're in for a rough ride.
Well, I was going to ask you what we can expect as we move into the cooler months in this hemisphere. Would you recommend that people are vaccinated against these other viruses in addition to COVID-19? As we see numbers and deaths seem to fall from COVID, do you think that we are in a decline, or will it get worse again?
Well, Elaine, I think the problem is we've so politicized vaccination that even something as bread and butter type vaccination as influenza, is already getting pushback. And too many vaccines, I don't know if it works, and I've never gotten the flu. And these kinds of attitudes, which are very similar to the things we've heard about COVID, are a problem. And we need, to hear more about influenza and maybe less about the two bills in the Congress.
I want to ask you about kids. A lot of kids are already back at school. It now appears that kids under 12 and their parents will have to wait just a little bit longer for that Pfizer vaccine pushed back a little bit. What do you make of the timeline? And what would mass vaccination of kids mean for this pandemic? Are you concerned that we could see some parental hesitancy in getting kids vaccinated?
Well, the Kaiser Family Foundation report shows that only 1/3 of parents who they reached said they would vaccinate their children. Now, I think this is early on, and we don't have that vaccine yet for the 5 to 11-year-olds. I mean, we have it. It's waiting approval. But I think it could make a big difference. I think Governor Newsom here in California has taken an enormous step forward today by saying that if you want to go to public school, you're going to have to be vaccinated once the vaccines receive FDA full approval. And I mean, that is a caveat, but, we need governors to step up, and we need this to become, a front page issue. And I don't mean threats to members of school boards and that sort of thing. I think we need to realize that we live in one world, all with each other, and unless we start thinking about that harder, we're going to suffer the consequences.
All right, Dr. Gary Richwald, thank you so much for joining us from California. We appreciate it.
Thank you, Elaine.